Here's another question. Is anyone gaining from this pandemic? The answer is yes. We have a list. And insurance companies, I can tell you, figure very prominently on it. They're making windfall gains. Look at what's happening in America. Insurance companies doubled their profits in August. America's largest health insurer, the United Health Group, reported a profit of $6.7 billion in the second quarter of 2020. Companies like Anthem and Humana doubled their profits too. The United States has a for-profit healthcare system, meaning the system operates to earn profits. It's a legit business. It's not public service. Patients are at the mercy of insurers. If you don't have a health cover, you'll have medical debt. What about India? The story is not very different here. Let me show you some numbers. Last year, a report claimed that 55 million Indians were pushed into poverty due to patient care costs. 55 million. Between 2011 and 2012, more than 80% Indians were paying for healthcare out of their own pocket. As of 3 years back, 56% of Indians did not have any health cover. These numbers were recorded before the pandemic, yes, but they tell a story, the story of how vulnerable Indians are when it comes to serious illness. This shows you how one hospital stay can cripple a household. Consider the treatment costs for the Wuhan virus in private hospitals in India. In the month of May, a report scrutinized the bills of 6 patients in India's top private hospital chains. The cost of treatment can go anywhere from 3 lakhs to 16 lakhs in cities like Delhi, Kolkata and Mumbai, which means you end up shelling out more than $20,000 for treatment for one person. $20,000 one person. Consider the per capita income of India, $1,837. That's a little over 1.35 lakhs. So how can someone who barely earns more than 1 lakh a year afford to pay a hospital bill that runs beyond 20 lakh rupees? And why are we paying so much attention to private care? Because that's what Indians prefer. As of 2015, more than 72% of the rural population and 79% of urban India relied on private hospitals for treatment because the public healthcare system in India is not up to the task. We all know this. The facilities are poor, the resources are limited. There is only one allopathic government doctor for every 10,929 people in India. That number alone should tell you how much stress our government hospitals are under. So people choose private healthcare, which is very costly. And this is where insurance companies come in. The idea of insurance is this: everyone pays a little so that if a major illness strikes, no one suffers a major financial loss. We all share the cost. Insurance companies are supposed to bridge the gap in affordability, but they're often accused of exploiting crises. American companies, we just told you, are profiting. Indian companies are accused of denying insurance claims. Since the outbreak of the Wuhan virus in India, several reports have accused different companies of denying payments. The matter reached the Supreme Court in the month of August. The court turned to the government of India. The question the court asked was this: why aren't insurers reimbursing the entire amount of treatment? Let me quote from what the court said. At a time of pandemic, the insurance companies cannot adopt a hands-off approach, especially when people are facing hardship. Now, here's something else you should know. Indian insurance companies are earning significantly more from premiums. According to one claim in October, the annual premium on health covers has risen by 40 to 70%, 40 to 70. By August, standalone health insurance companies collected premiums worth 6,268 crores. During the same period last year, the same companies had less than 5,000 crores in premiums. This is a growth of 9%. By September, insurers had received a little more than 2 lakh claims. That amounts to more than 3,000 crores. What do all of these numbers tell you? They show that insurance companies are still sitting on a significant pile of cash, and they're exploring new business models, offering new products in the wake of the pandemic, policies that specifically cover the Wuhan virus. You may have been offered one too. And there's nothing wrong in doing business, nothing wrong in making a profit. After all, insurance is not public service. But exploiting fears and denying claims while hapless citizens remain stuck in the fine print is plain wrong. Thank you for watching Gravitas on WION's YouTube channel. If you want to stay up to date with what's happening around the world, then subscribe to our channel and don't forget to like and share. Thank you very much for watching WION. World is One.